Hello and welcome to the Uprising Show. And today I have a very special guest from Brooklyn, New York. I have Nisha Desai. Nisha, could you take a minute and introduce yourself to our listeners, please?
Of course. Hi, everyone. Thank you so much for having me on the show. My name is Nisha Desai. I am the COO and co founder of Anise Health, and that is a culturally responsive mental health startup for Asian Americans. So, have been working on that for a couple of years, and I'm excited to share more.
Wonderful. Well, Nisha, before we go into the company and the business, let's talk about a little bit about your upbringing. So, where were you born and raised, and were you an entrepreneurial kid who was on the lemonade stand? And is either of your parents an entrepreneur?
Yeah. So, I was born in Orlando, Florida, born and raised here in the States. But that means I'm second gen Indian American. And so definitely grew up in kind of a classic South Asian household. My entire family is in medicine. So, like, my dad's a doctor, my mom's a microbiologist, my grandpa's a doctor, my sister's a doctor. And so you can imagine growing up, I could have easily wanted to be a doctor, but I was kind of the black sheep of my family and was always very interested in business. Interestingly, of course, I came full circle back into healthcare. But I think as I think back and reflect, I've always been interested in the industry because of the fact that I came from a family of clinicians. But rather than, making that impact on one person in a one-to-one patient relationship, I've always been really intrigued by like making systemic change, finding improvements in the healthcare system, whether it's with insurance or access, or in this case now, like culturally responsive care. So yeah, I think a lot of that has played into why I'm working on what I'm working today. But in terms of entrepreneurship, I also interestingly do have a lot of entrepreneurs in the family. Even though they are doctors, they've kind of started their own businesses. So my dad started an urgent care company when I was, I think, in elementary school. And he just actually sold that like 2 years ago. So it's
Wow.
been cool to see his journey, starting a business that operated a little bit more like a small business as opposed to a VC backed business, but still kind of got to see him go through the challenges of hiring and funding and meeting revenue expectations and patient complaints and all of that stuff. And then my grandpa started a diagnostics company back in India, that he sold to a Japanese diagnostics company. Was very successful entrepreneur. So I have a lot to live up to. And I think it serves both as inspiration and also just like whenever the going gets tough and I, think about wanting to just like have an easier life, I think back to both of them and how hard they worked, and kind of makes me want to continue grinding. So definitely a part of my story.
Wow, nice. And is this like when is that you decided that like I want to be going through this route, and or maybe even decide that I don't want to be a doctor. When
Yeah. I think that I don't want to be a doctor was like when I was in elementary school. It was very early on. I always had a knack for like I said, business, whatever that means. But like as an example, I was a Girl Scout until I went to college, and I was always extremely intense and competitive about the cookie sales. I would go around to every single house in my neighborhood until I hit like my target of however many cookies it was that I needed to get like first place and win whatever prize it was. So just, stuff like that. And I remember also when I was in elementary school, I like begged my dad to let me buy a stock in Disney, because I wanted to know what the stock market was like. So I think I've just always been interested in other things. But entrepreneurship for me was definitely a later thing. So in undergrad, I went to Penn Wharton School undergrad, and I studied finance. I was an investor and a banker and all that stuff in my early career. But it was when I was a healthcare investor that I kind of first started coming into contact with more and more entrepreneurs. We were investing in early stage businesses across health tech, healthcare services, and behavioral health specifically. And so I just met a lot of really cool founders who were building interesting companies, tackling challenges to the healthcare system that just felt like much more exciting to me than being kind of like a client services professional. And so that's actually why I decided to go to business school, is because I wanted to pivot into being an entrepreneur, or at the very least an operator in the industry. And so that's when I started getting kind of my hands dirty with operations. I worked at a healthcare insurance company as a product manager. And it was actually during that time when I was a product manager that I came across this idea of building a culturally responsive mental health company, and met my co-founder during business school. So it was kind of by happenstance that like the stars aligned, and I was very passionate about this problem space that I decided like, why not? I have nothing to lose. I'm young. I don't really have a ton of other commitments. I'm in business schools. There's like really no like reason for not trying. And then, you know, one thing led to another, and here I am 3 years later, still working on it. So yeah,
So the
that's the story.
inception of the company or the idea was during your time in the business school. It happened there. Oh,
Yeah.
interesting. Great. So, well, what was the insight that led to the creation of the company, and also like what specific problem does the company solve today, and how are you approaching it different from other solutions in the market?
Yeah. So I would say the insight was kind of like twofold, and it really started with my personal experiences earlier on in life. Obviously, I didn't build the company then, and that's where the second kind of moment of insight came, which was the professional experience that tied both my personal and professional experiences together, and kind of just helped me realize that like this was something I needed to work on. So on the personal side, I mentioned already I'm second gen South Asian, and so from a household that in some ways can be traditional when it comes to mental health as well. I struggled with my own fair share of issues growing up, but I was always told to tough it out and get over it. That was the motto in my household. We never talked about emotions, and in fact, my parents kind of always viewed the fact that I was an emotional person as a negative, and told me that I needed to change that about myself. So what that all kind of manifested itself into was that I have always really struggled with seeking help for any problems that I'm going through, whether it's with friends, and definitely not a professional. But in college, there was a mental health crisis on my campus. There were unfortunately 14 suicides during my time at Penn and the couple of years after I graduated. And almost all of those people were people of color. Almost all of those people of color were Asian. And so as I looked at the situation and my own experience and my own difficulty with seeking help when I needed it, I couldn't help but wonder, like, what are these long term impacts of us not feeling like we can seek help? And so I went to care for the first time and had a horrible, horrible experience. I felt really judged by my provider, and it just became very quickly apparent to me that like this system that our kind of mental health care is based on is very one size fits all, and it's not built for people like me. And so I dropped out after just one session, and basically had this red flag moment that was like, okay, like if we don't do something about this in the long term, there are going to be more people who, either don't feel comfortable seeking help, or when they do seek care, they're left with this like horrible experience and they drop out, all of which leads to that like untreated mental illness. So interesting statistic that is also very sad is that Asian young adults are the only racial group with suicide as the leading cause of death. And that's something that impacts me every day, but is a big reason underscoring why, we are trying to change that narrative and build a solution that is tailored for our unique needs. The professional side of my story, I'll share a little bit more about it later. It's less interesting, but it's basically just, in my job as a product manager, heard from so many users when I was interviewing and testing with them the same exact thing, the same thing that I had experienced, that they were dissatisfied with all of the one size fits all digital mental health solutions that were out there. So it became very clear to me that there was a gap in the market and someone needed to be solving for something that was more personalized, and something that was just targeting the unique stressors that we experience as children of immigrants, or honestly, even first generation Asian Americans who deal with their own stressors that are really under researched and definitely not implemented into kind of standard treatment models.
So I have a couple of follow up questions to this on the how part of it,
Mm-hmm.
how it's done,
Mm-hmm.
and uh, and I can also be very open and share my experience because I'm just immigrated, right? And this is the first time in America,
Mm-hmm.
and and it happens that my wife is American, and
Mm-hmm.
uh, and she's white, and it's different culture, and one of the things that I notice is um, culturally, it's just we are not open as emotionally to express everything, and it's very different. Like, yeah, I need to, like, thanks to my wife over years, I worked through this, like talking and expressing in a way, even though my
Mm-hmm.
intents were always good, it just like never communicated, right? Like, it just not
Mm-hmm.
culturally comes to me, right? Like, and that's how I was raised. So so that's for sure is important. Now if I go and seek help, is it like you are building a solution where it's more matching of providers based on the cultural aspect, like you will match to the Asian providers, which I don't know, I'm unknown to the solution, or is it more like no, you're finding providers from different cultures, and but finding a fit through some kind of a better standards or
Yeah.
proprietary intellectual something you have built, and you assess and then you do that. How is work how
Yeah. Good question. And yeah, I didn't actually get to the solution side of your question, like how we're actually solving this problem. So I guess I'll clarify that there are kind of like there are two sets of issues at play, one on the supply side and one on the demand side. So on the supply side, there aren't that many diverse like therapists of color out there. And there's very, very limited training in grad programs around multicultural counseling or culturally sensitive care. So people are undertrained when it comes to this whole area. And then, secondly, there's very, very little research that has gone into the current standard of care that is representative of people of color. I think Asians represent less than 0.1% of clinical trial data for the current standard of care. So that's on the supply side, and then demand side is everything you mentioned, right? Like this cultural value placed on like emotional restraint and lack of awareness of just what even mental health is, or like how do I even get care, that leads to just like limited awareness and help seeking behavior. And then when people do try seeking help, they often don't see progress because, well, talking about emotions doesn't come naturally to a lot of us. So those are all things that we are solving at Anise through basically the second approach that you described, which is we don't just do ethnic matching. Like we aren't just matching Asian people to Asian therapists because, well, A, that's not scalable, and B, we don't want to be creating something that exists in a silo. We want it to be the new standard of care. And so in order to do that, we do a few things. One, we've built a care model that is designed specifically for the Asian population. So it integrates therapy with coaching and digital tools. Coaching is kind of a modality that resonates much better with the Asian population for a few reasons. If you think about, this concept of emotional restraint, sometimes therapy can feel really daunting or really ineffective when all you are doing is talking about your feelings. Coaching really helps to then take those conversations and turn them into action. That resonates very well with also like very achievement oriented Asian Americans. And then most importantly, you see kind of improved progress because kind of each goal, each therapy goal that you are working on with your therapist gets put into action and you start seeing outcomes faster. So this entire model is very kind of like outcomes focused for the Asian population. And then the digital resources focus in on those cultural stressors that are very unique to Asian Americans. So things like bicultural tension, what is it like constantly balancing maybe like Eastern value sets at home and Western value sets in the school or the workplace, people pleasing, shame and guilt, because perhaps you feel like you owe something to your immigrant parents who came over to the States and sacrificed a lot for you, right? And so then you feel like you constantly have to measure up to their notions of success. Perfectionism is something that we see really commonly as well. There's like a whole suite of stressors, microaggressions in the workplace, especially recently post pandemic with the Asian hate crimes that we've been seeing a rise in. These are all things that we address through these different types of digital modules that we use AI for to kind of like hyper personalize and recommend to individuals between sessions. So think of it as a holistic package that from end to end is adapted. Even the assessments we use to help identify and diagnose patients are culturally attuned. So from end to end, it is a hyper personalized and just tailored experience. And then the last bit is that all of our clinicians go through training. So the therapists and coaches that you get assigned to as part of your care team have undergone extensive training at the beginning of their onboarding, and then every month they're part of like a consultation group to help sharpen their skills and cultural sensitivity. So overall, an entire experience focused on just consistent quality of care.
Got it. And just from the business model point of view, is it
Mhm.
directly to the consumer? You are, offering your services directly, and that's your customer that you're acquiring, or is it more like you're giving to the providers and telling like, this is for you, and now you bring your, these populations and treat them here? How does it
Yeah.
work?
We're acquiring customers, but we're doing it through insurance. So it's like a B to B to C model where we have payer contracts with payers like Aetna, Magellan, Optum, etc., Blue Shield. And then through those contracts, we're able to engage patients through referral partnerships with organizations that are in network. And then, of course, we also offer self pay subscriptions. So if anyone doesn't have insurance or doesn't want to use insurance, then they can also leverage one of our affordable subscriptions, which are basically like monthly, on a monthly basis. You get access to a fixed number of sessions and unlimited access to the digital modules. So that's how it works right now. It's a mix. We just started accepting insurance in the past year. So we're shifting more towards that kind of business model as things ramp up.
So, and now this is, you are basically, as an organization, you have your own NPI and you're hiring providers as on your payroll, and then you're
As
gonna.
part of the group practice, and then we're paying them, yeah,
Got
based on how much we collect from the insurance company.
Cool. And these sessions and these this is all remote, or is it in person as well?
Yeah, should have mentioned that everything is all online. It's digital first. Not to say that we wouldn't expand into a hybrid model in the future, but for now, it's telehealth.
Great. Okay. And now to your product manager experience at
Mhm.
Imana, and you were building, or you built, asynchronous text-based therapy product there, and I think you briefly touched somewhat of that experience help you with the insights on building this company
Mhm.
as well. So could you shed some light on your experience there building that product,
Mhm.
how that helped you in taking the move in building this?
Yeah, I mean, it was extremely crucial towards me making the move because it just gave me the kind of core insight that I needed to feel validated that like my experience is also being experienced by many others. We were building, like you said, asynchronous text-based therapy mobile app for the commercial population at Humana. And we were actually working on this in partnership with Talkspace. So Talkspace's kind of underlying technology was what we were leveraging, and then rolling it out with kind of like a Humana facing experience for the commercial group. And so even working closely with Talkspace, which at the time was like one of the leading and only digital mental health players that was like as big as it um, was just very eye opening for me, right? Like on one hand, access to thousands of clinicians at like just by like the click of a button was really exciting, and something that people valued the convenience of. But on the other hand, there's a lot of variability in quality, because it really is just a matching platform. At the end of the day, you get whichever provider you kind of match with, and then they could be great, they could be not great, but it's kind of up to the provider to do whatever they want. And also, of course, the asynchronous modality was controversial, because at the end of the day, I think a lot of folks still want human driven care. And so even with like AI floating around in the world, and asynchronous text, I think these things are all really great at like at this stage, kind of supporting therapy, supporting coaching, but not necessarily being the primary modality of care. And then, of course, as I already mentioned, through the interviews, I learned that almost all of the reasons why people of color were dissatisfied were related to somehow their cultural background. So whether it was provider incompatibility and like them feeling misunderstood by their provider, or just lack of progress because the care model, the interventions weren't really suited for their unique needs, or language barriers were also another big factor. And so people were just dropping out of care, and very low engagement with the kind of digital app from people of color. So all of that stuff, obviously, for me at the time was not good. I was owning some of those metrics, but I think it gave me a critical insight that like there needs to be a more personalized experience for those of us who inherently just aren't really a part of the standard of care that was built today. So that was hugely, hugely helpful. And then also through that process of working at Humana, I picked up on some critical skills around product, human-centered design. One of our advisors, was someone that I worked with closely at Humana. So built a really strong network and also got to understand a bit about payer contracting. So all of this was super, super useful for where I am now.
Great. And you are, I am suspecting, more than one state right now, or
Yeah.
eh, and how where what state you are in? How many states?
We're in 5 states now. We launched initially in California, and then since then we have expanded to New York and Washington, Massachusetts, and Florida. And we do have a couple of providers who are part of the SciPact. It's like an interstate compact that allows psychologists to see patients across some state lines. So we're slowly starting to build up our capacity in other states as well. But our 5 key states are those 5 that I mentioned at the beginning.
Great. And I have also helped work with few companies where it's a similar model but different specialties. And
Mm-hmm.
when it comes to growth, right, you're always playing this this equation of provider contracts, states, building demand, and that's kind
Yes.
of the cycle you have to play, right? So that gets exciting. The metrics keep growing between how you're building those things. So that's
Yeah.
always exciting part of growing the business. I'm sure you're probably tackling problems, and it's not easy because today
Absolutely.
all
That's
those
the hard part for sure.
exactly. The good thing is, I just saw a couple of reports actually not too long ago, last week. One was just telemedicine trends, and it shows that almost 48% of all telemedicine providers who are doing it is doing telemedicine in mental health. So one thing is clear: it's now mainstream. It's no more an industry we are playing catch up with. All other specialties are
Yes.
still playing catch up, but mental health is where clinicians are open, patients are
Yeah.
open, everything is starting to happen there now, which is good and a bad too, because that means there's competition. There's a lot of
Yeah.
competition. And then you mean like, yes, it's one of those, like there's every second company is a mental health company in telemedicine.
Hmm. Yeah.
The other thing is, which is fascinating, is the trend of outside of mental health, other specialties are trending up in
Hmm.
telemedicine,
Hmm.
and which is kind of tells the whole state of the healthcare system overall that we're all moving towards this, which
Hmm.
makes me optimistic that no um, mental health in isolation also doesn't work. Somewhere it needs to connect with primary care, and I
Hmm.
feel like
Yes,
as we are
absolutely.
moving towards all these things, we'll probably see, hopefully in few years, even consolidations happening in the industry where all those things come together. How these different specialties work together. What are your thoughts of this? What are you seeing? Some exciting
Yeah.
trends related to this?
I mean, I couldn't agree more about the primary care point. And just as we think about like our vision for the company, we like our vision is to become the gold standard of minority mental health care. And what we mean by gold standard is not, like I said earlier, like not existing in a silo, but being integrated into the healthcare system so that really anyone who holds any sort of like intersectional identity can get care from their provider or their like like their health insurance company, like all of these different players that play a role in your care are culturally sensitive, right? They're all trained. They understand what it means to be culturally attuned and adopt culturally adapted assessments and diagnostics and tools, digital resources. So I really do see us integrating into the broader system, and that's why actually like a big focus for us in terms of like customer acquisition is on forming partnerships. As an example, we have a partnership with Spring Health, who is a larger mental health player that focuses on employer relationships. So it's just an example of like, their focus is on kind of access and personalized care, but that doesn't necessarily mean their expertise is in culturally responsive care. So for their Asian American clients who are seeking culturally responsive therapists that specializes in their needs, they're able to refer to us. And so that's one example. We also try to partner with counseling centers at universities. So, like Stanford is an example of a university counseling center that we partner with closely. They're a network with Aetna. And then we're trying to establish relationships with PCPs as well. That's something that we're working on kind of as we speak, because, like you said, it's something that does need to be integrated. So, huge proponent of that. I think in terms of telemedicine, I view it as mostly positive. A lot of the uptick in mental health in the telemedicine space happened around COVID, which is also when demand started skyrocketing amongst Asian Americans. Prior to that, there was like severe underutilization. We were like the least likely of all groups to use mental health care. I think it was like 3 times less likely than the general population. And so just the rise in telemedicine has made it easier, b less intimidating and stigmatized. It's like from the comfort of your home. You don't have to like feel like really intimidated by having to like drive to someone's office and like sit on their couch stereotypically. So the telemedicine trend has helped, and for us it's like I said, like causing demand to increase. So it's like we have to do less work on the psychoeducation and demand generation side, which is nice. And then from a cost perspective, obviously it's much easier for us to scale in the initial days with a telemedicine infrastructure. And so I think it enables us to get our business off the ground. Ultimately, in the future, hopefully we can build more of a hybrid presence for those who want in-person options. But I think that telemedicine trend works in our favor. And then the partnerships enable us to like plug in to the system without being like competitive to some of the other mental health players that are out there.
Interesting. So, just in terms of acquiring customers today, is it is it fair to say that initially for the last couple of years the focus was direct acquiring patients, and now it's more towards partnerships through that? You're going toward that direction. Is that how it's
Yes,
working? Okay.
exactly. Yeah, so definitely was more like traditional D2C for the first year. And then now that we have these contracts in place, we're trying to establish those in network referral relationships. And that is driving like the majority of our customers at this point. And then, of course, we've tested strategies like paid ads as well, which we will have to kind of do in the background. But if we kind of were to prioritize all of them, I think number one will be partnerships. Number two has actually been like content marketing and organic SEO, because we also play a role as like a thought leader in this space. Like I said, there's little data out there. There's a lot of stigma in our community. So sharing stories about mental health journeys of different people and putting out psychoeducation content kind of goes a long way in breaking down some of those access barriers. And so the content, I think, has helped us establish ourselves as, like I said, a thought leader, and has also served as a great like source of traffic to our site. So those two have been the top two. And I think number three will be our paid strategy, which, we'll see how cost effective that is at scale, because there's a lot of other players targeting similar keywords that are spending like millions of dollars on ads. So it's a little difficult to compete in
Yeah.
that way.
Yeah. It's from my experience, it's like couple of things here, right? Like, of course, partnerships is going to be more of a play where either they're just, you probably meet them at conferences and stuff, you figure out that route, or there is things like how do you build, I think you pointed out this briefly touching the thought leadership part. I think that's going to be big because it's again I don't know if you're tapping all the channels yet in terms of educating TikTok, etc., the world, which is now number one channels that's just educating audiences, and then long form is YouTube. That's how it's going to.
Yeah.
But to catch the attention, especially related to things like like topics like what you guys are handling, that's going to be. I don't know if you guys have tested. Have you tested anything on TikToks and build content stuff there, or is this something?
Yes. Sorry. We have briefly, and I agree it is a really interesting space. It requires a lot of resourcing to basically post videos every day and do it in a way that's creative and authentic to your brand. So it's really just a matter of time before we can like build our presence on TikTok, because we
Yeah.
need to raise some money first. But we're definitely interested in TikTok as a channel for content.
Okay. So speaking of challenges at the moment, what are your biggest challenges?
Yeah, I think a couple ones that kind of all companies at our stage go through. One is fundraising. I think the market right now is tricky, and so we're raising our seed round as we speak. We're like 50% of the way there, which honestly is a win in and of itself, because we have a lot of founder friends who have been unable to raise at all. So it's going okay, but it is a challenge. It takes longer than expected. And right now we're very much living in an AI bubble where a lot of investor interest is focused on companies where AI is like their primary differentiator. And then as it comes to healthcare, because there are so many mental health companies out there, some investors are already conflicted out as they have previously invested in a mental health company. And so the pool of like available investors who are interested and who are deploying funds actively right now in this market is limited. So yeah, just working through some of those difficulties. And then the second one is around growing, right? Like we have these contracts, but the ramp up with payer contracts is slow. It's not like the hockey stick growth that tech companies experience and that a lot of investors expect. We're a care delivery company at the end of the day, so the that growth looks different than tech, and that's something that we have to reconcile. And so we're trying to find ways to grow faster, but of course that's always a challenge. And ultimately, very happy with our progress, but we can be doing
Yeah,
better. So just trying to figure that out. Yeah,
yeah. It's like that space. I always say, like, I worked in different areas in healthcare, and last one was home care, right? And home care has the least margin. So when you bump into investors who are coming from the
from
tech,
like B2B SaaS.
exactly, and then you have to explain them and educate them on the home care margins.
Yeah,
It's like a day and night difference, right? So it's interesting problem. So is that like, are you kind of like tapping into a specific set of investors for this investment? Who are they? What kind of, what are you?
definitely. Yeah, I mean, we've learned our lesson from our pre-seed. That also took us a while, but we got it done. And the way we got it done was by focusing on investors who are like healthcare focused, not generalist, and ideally even health tech focused, because then they just are like a really good fit for what we're building. And then the second one that I think sounds like obvious, but wasn't obvious to us at the time is just folks that are just like they just fit with us as co-founders. So one thing my co-founder says, who leads our fundraising efforts, is that like fundraising is a lot like dating, and before we were approaching it in like a very transactional way, like okay, just like pitch, data room, like whatever, can we get you an ROI on your investment? But I think what we've learned throughout the course of fundraising is that it requires a lot of relationship forming, and the investors that have ultimately ended up investing are ones that we've just clicked with as people. A lot of times it's people who resonate with our idea and the problem space and the mission. So whether that means they're Asian themselves, or maybe they have like a partner that's a minority, or they've just experienced it firsthand through some form or fashion. That tends to be where we're able to build a relationship over time, and just get them to trust that like we are the right founders to execute on this idea, which is still very early stage. I think in today's market, a lot of investors want really high bar of traction, to de-risk the investment, and so that relationship piece becomes even more important if we want to raise at our level. So those are like a couple of the things that we've learned, and as we're raising now, we are pretty laser focused on healthcare investors, health tech investors, investors that we meet through warm intros, people in our network, because that probably means they're like one step closer to believing in us. And more recently, also looking at impact funds, since we do have this like mission oriented uh, solution.
Interesting. Yeah. um how does your traction number looks like? Anything that you could share?
Yeah, so, well, I'll say like the 5 markets, we have 4 active payer contracts of our own, and then we are also accepting insurance through Headway as well, with several other insurance plans. So those are some like meaningful traction, and all of that is going to get us to about 1 million in ARR by the end of 2024. So yeah, that's what I can
Great.
share for now. But
Yeah, yeah. No, you're on a good start. That's how it
mm-hmm,
is. We know how this works. Like, startups to get to 1 million is very,
mm-hmm,
what percentage that is, right? So,
mm-hmm,
all right. So, the interesting thing about different companies or startups is that you go through different phases. and there are phases everything might look good from outside, but it's really inside the company's chaos, right? So tell me about a situation when you were like in total, a total or running out of cash, and you just were like, I don't know, did it happen to you ever in this journey, and if at all, how did you get out of that?
If it doesn't happen to you, you can hardly call yourself an entrepreneur. It happens every day. But it's hard to pick one. Like two good stories come to mind. One is like when we were just doing our pilot. This was like we had like I don't know, like $10,000 or something in grant money. Basically nothing. And we didn't have a business. We just launched a pilot. And we needed to build like a product from the ground up. But we had no money to pay engineers. So we hired like two interns from undergrad. One was like a freshman, the other one was a sophomore. they were like, they were super inexperienced. I have a product background, but I'm not technical, so I can't code. And we built this product like truly from the ground up in a month. And so it was obviously like an MVP. It wasn't anything great, but when we finally launched it to launch our pilot program, like every time a bug came up, I think I had like a panic attack because I'm also a first time founder, right? And I'm also a perfectionist. I'm South Asian. And so every time something happened, I was like, oh no, like this is the end of the world. And I was like actually having panic attacks like often. And I think that whole experience just taught me the value. To be fair, they built something pretty decent for their level of experience and the time that we gave them. But I think it taught me the value of like really investing in a good product experience. I think especially when you're a telehealth company, your target audience is like ages 18 through 35. Everyone's young, expects like a slick experience. I think it's worth the investment in good design, good just UX. And, if I could do things differently, I think I would definitely try to invest in that a little bit earlier on, because that was very, very rough. And then the other one is just with fundraising. I think like there was a time period when we were raising our pre-seed where we were going to run out of cash in like a month. And we had been raising or trying to raise for like a while. I want to say like 5-6 months. And just kind of targeting the wrong people, right? We were having like hundreds of conversations, but it was like generalist funds, people who didn't know anything about healthcare, people who like really were probably seed stage investors, but were like talking to us, but we were never really in their sweet spot for pre-seed. And then we learned this lesson that I told you earlier, which was like, okay, focus, leverage our network. And one of our advisors came through with a connection to someone who was health tech focused. The managing partner is Asian. We got along with them really well, and they, kind of gave us the term sheet in the nick of time. And then like us just announcing that in like a press release that we had like our lead investor and we were doing a first close. Like it's so funny how much like FOMO is a thing in VC world, but we had like a bunch more inquiries come in afterwards from people who were interested in participating. So we ultimately ended up raising like 2 million in pre-seed, and had a really great outcome. But it took a long time. We had our backs against the wall, and it took like resilience and also creativity around like how we get this done to get it done.
Yeah, interesting. Um, so looking ahead, right, where do you see the company in long term?
Yeah, similar to what I was saying earlier, I want it to be the gold standard of mental health care for anyone who holds some sort of intersectional identity where like culturally sensitive care is integrated into PCP offices, into all mental health companies, into health systems, at insurance companies where like care navigators are playing a role. So I would love to like get to a point where our training programs and our like culturally sensitive treatment models are being adapted by institutions across the healthcare system. That's like the big bold vision. But in terms of how we get there, we want to expand into other lines of business. Right now, we're servicing commercial population. We want to enter Medicaid next, and then we also want to service adolescents. Right now, it's ages 18 and up, but there's a really big need amongst young adults, especially in communities of color. And then we want to expand service lines. So start offering family therapy, group therapy, couples therapy instead of just individual therapy. Um, all of that will help us kind of have a more robust platform. Oh, medication management as well. And once we get that going and we're in more states is when we can start to get those national contracts and start to actually integrate more into the system. So those are some of the things that we have in mind. And eventually, who knows, maybe we can serve the global Asian diaspora as well. But for now, focused on the States.
Great. So this has been great. Thank you for taking time. I
Mhm.
like to end the pod with one fun question. And the last question is, tell us about a personal thing that no one in your professional circles know about it. And this is your chance to tell them. Anything that you feel is appropriate to share, could be anything, and is your shot.
uh, I don't know if no one knows this, but I have like a unhealthy obsession with roller coasters. I in general like thrill adventure things. But when I was in high school, had an annual pass to Universal, and so I used to go there like every weekend. And one time rode the Hulk 13 times in a row, which is like my favorite roller coaster. So yeah, I guess I like the thrill, which maybe is why I'm also working on a startup.
That
But
explains.
yeah.
Yeah, that explains. Well, great. Thanks for sharing. So, where can people find you and hit you up?
Yeah. So our website is www.anisehealth.co. And all the information that you need is there. Our intake form, which kind of starts the process of signing up for our platform, is there. And if you have any questions, you can find us either at Anise Health on Instagram or email us at info@anisehealth.co. So yeah, definitely reach out. We're happy to help, and check out our blog as well. We have a lot of good content on there.
All right. Well, thank you again for taking the time. This has been great. And anybody who's listening it, you know where to go. And we will also put this in our show notes. And yeah, thanks again for your time, Nisha.
Thank
Much
you.